I'm Dr. Gurpreet Padda, Regenerative and Interventional Pain Physician at Regen.MD. I have a confession to make. For the first half of my 30-year career, a career built on the lessons of survival I learned as an immigrant, and in the St. Louis projects, I was a master of symptom suppression. I was a clinical commander in a war against signals, not causes. I could quiet almost any pain, a targeted steroid shot here, a high-dose prescription there, and in the industrial medical assembly line, we called that success. But I wasn't asking why the fire started. I was just painting the smoke white. If you've spent years getting your symptoms managed, while your health continues to decline, you've been on the receiving end of this exact failure. It's time to stop managing and start regenerating. You've collected treatments like souvenirs, the pills, the injections, the repeated procedures. Each one buys a brief window of silence before the signal returns, louder than before. Somewhere in this cycle, you stopped being a person seeking health and started feeling like a permanent patient, defined by a management regimen that never actually heals. This isn't your failure. It's the logical outcome of a system designed for suppression, a system that views you as a data point in a spreadsheet rather than a human being in pain. When the body sends a signal, the traditional orthopedic paradigm reaches for a muffler. You were managed. You were never treated. My promise today is to bridge that gap. I'm going to show you the forensic difference between silencing a symptom and solving its root cause. We will deconstruct why the suppression model is economically incentivized to fail you, and I'll provide the root cause framework that actually changes your biological trajectory. This is about moving from the assembly line to metabolic sovereignty. By the end of this masterclass, you will have the clinical sovereignty to know whether your care is treating the fire or just chasing the smoke. We're fixing the terrain, not just the signal. Let's look at the objective data. Take cortisone, the gold standard of management. A rigorous trial published in JAMA demonstrated that repeated steroid injections actually caused significantly more cartilage loss with absolutely no lasting pain benefit compared to saline. The symptom was silenced, but the disease advanced in the shadows. We are trading long-term structural integrity for short-term chemical silence. This is the normal MRI trap. We see a quiet scan, but the metabolic fire is still incinerating the joint. We must stop the glycation and the glucotoxicity that drive this destruction. The root is almost always metabolic. Chronic pain is not just a structural issue. It is bidirectionally linked to metabolic dysfunction. We are talking about meta-inflammation driven by LDL-P, TNF-alpha, and IL-6. When your biological soil is toxic, the pain signal always regenerates because the environment is still fertile for inflammation. If you don't address the mitochondrial retrograde signaling or the glymphatic clearance, you are just rearranging deck chairs on a sinking ship. We target cytochrome C oxidase for mechanotransduction because solving pain means going after the metabolic engine generating it. Now, let's follow the money. This is the non-obvious truth that the industrial medical complex won't tell you. Symptom suppression is a renewable resource. A cause, once solved, stops generating revenue. But a symptom, endlessly managed, generates cash flow forever. The economic machine is optimized to keep you comfortable enough to stay, but uncomfortable enough to return. A healed patient is a lost customer. The reason nobody chased your root cause isn't necessarily incompetence. It's that the cause was never the profit center. In the corporate medical model, the symptom is the product. We reject the assembly line model. The Regen.MD protocol starts with a diagnostic map that finds causes. We look at the biological soil, fasting insulin, triglyceride to HDL ratios, and the full metabolic picture. We utilize sub-millimeter precision under power Doppler for orthobiologic injections, not just to mask the pain, but to trigger mechanotransduction and tissue repair. We track digital biomarkers like HRV and movement cycles via Measura.ai to prove recovery. We aren't guessing. We are auditing the signal with forensic precision. The plan is simple but rigorous. First, demand a map, not a description. Second, change the highest leverage input. Cut the acellular carbohydrates and industrial seed oils that fuel the fire. Third, support genuine repair with orthobiologics, PRP, platelet lysate, or BMAC, delivered with sub-millimeter precision to the Baxter's nerve or the labral tear. And fourth, track your markers. We are talking about CGRP modulation and mast cell stabilization. If your HSCRP isn't dropping, the fire isn't out. You solve it once, so you don't have to silence it forever. This is about metabolic sovereignty. You stop renting silence and you start owning a solution. At Regen.MD, we are reanimators. We don't just manage your pain, we hunt the fire, we fix the terrain. If you are tired of being a line item in a corporate insurance ledger, if you are ready to reclaim your agency and your energy, book a consultation at our Woodson Road facility. Let's find what is actually driving your pain. Stop managing, start regenerating. I'm Dr. Gurpreet Padda, and this is the end of the industrial medical model.